Can't touch this. Can't touch this. Can't touch this. Can't touch this.
Bloodborne pathogens, or BPPs, are viruses, bacteria, and other microorganisms that are present in human blood that can cause disease. The most common BPPs are hepatitis B, hepatitis C, and HIV.
Can't touch this. Can't touch this.
Hepatitis is an inflammation of the liver, which can lead to liver cirrhosis and cancer.
This is a healthy liver, living a clean life, healthy life, and using your Fitbit every day.
This is a liver with cirrhosis after being exposed to bloodborne pathogens or summer vacation.
Can't touch this. Can't touch this.
HIV, or human immunodeficiency virus, attacks the immune system and can lead to AIDS. It's most commonly spread by sharing contaminated needles or unprotected sex.
So if you're going to use a needle, use a clean needle, not a used needle.
And if you need it, we have birth control available at the health department.
Can't touch this. Can't touch this.
Use universal precautions to protect yourself. This means treating all blood and bodily fluids as if they are infected. Put on gloves or use a barrier to protect yourself and others.
Can't touch this. Can't touch this.
There is no cure for hepatitis or HIV, only treatment. Getting the hepatitis B vaccine will help for protection against BVPs. It's only a series of 3 vaccines.
3 vaccines?
That's it!
That wasn't so bad.
Yay! Bloodborne pathogens can take you by surprise. Practice these safety tips and you might just survive.
Hand washing is the #1 defense against viruses and bacteria. Wash your hands before eating.
After using the bathroom.
And after contact with soiled items, personal hygiene, or first aid. Hand washing should be done for at least 20 seconds. Wet hands, thoroughly scrub the hands, fingers, and wrists. Rinse and dry. Use a towel to shut off the water. You may sing happy birthday 2 times to get your 20 seconds in of hand washing.
Oh, there's no soap. Use hand sanitizer if no soap and water is available. 60% or greater alcohol content is recommended.
Personal protective equipment is to be used if exposure to blood or body fluids is likely to occur. Gloves, masks, and glasses or goggles, gowns, and resuscitation masks.
Always wear gloves when assisting others with first aid. And personal hygiene. Also make sure you remove gloves properly to avoid contamination. Use a sharps container for needles, a puncture-proof container for broken glass, and red bags for heavily soiled items. Always keep gloves in your desk drawer. And in your recess bag, please do not forget to take it to recess. Please keep gloves,
Band-Aids.
Tissues.
Jake, where's your recess bag at?
I don't know.
Jake, you're grounded. The exposure control plan contains all the information in this training required by OSHA. And exposure to bloodborne pathogens is defined as direct contact with blood or other bodily fluids. Via the eyes, the nose, the mouth, or a break in the skin such as a cut or a rash.
If an exposure occurs, wash or flush the area immediately and report the incident to me.
Julia, it's Megan. I feel terrible today. I'm gonna have to call in sick. I've got a fever and the chills and I'm aching all over. I just can't do it today. I'm sorry.
Oh, I'm sorry to hear that, Megan. I wish you felt better, but I do thank you for not coming in sick today. You know, when you have fever, vomiting, and diarrhea, you really should stay home so that you don't spread the germs to everybody else here. Did you get your flu shot this year? If not, you might want to really make sure you do get that next year, because that can help cover that you don't get sick again, and make sure you're covering your mouth when you cough and sneeze so that we don't spread it, and it'll keep you healthier and everybody around you too. So feel better. We'll see you tomorrow.
Can't touch this. 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 Can't touch this.